Alright, so sympathetic antagonist. We have to talk about alpha blockers and beta blockers and their classifications and their indications and their side effects. First is alpha blocker. So we have to classify it as non-selective, alpha 1 selective, and alpha 2 selective. These are classified according to the receptors that they act in. In the non-selective alpha blockers, both alpha 1 alpha 2 are affected. The example of drugs are phenoxybenzamine and pentolamine. So indications is first one is pheochromocytoma. Pheochromocytoma is nothing but there is a benign tumor that in adrenal medulla that secretes epinephrine, and increase the sympathetic flow in the body. So we have to block those effect. So we use both alpha 1 and alpha 2 blockers. Next, peripheral vascular disease, PVDs. Raynaud's syndrome. Raynaud's syndrome occurs in mainly women whose sympathetic activity is more enhanced. So they are classically seen that their fingertips getting necrosis, ischemia, and gangrene. So in chronic arterial ischemia, we talk about Raynaud's syndrome mainly, and penile erection in mainly due to constriction of penile blood flow. We have to block the sympathetic flow and dilate those vessels. So also we can use phenoxybenzamine pentolamine, but mainly we use penile erection or impontation, mainly the nitrous oxide to dilate blood vessels. In side effects, there is postural hypertension and reflex tachycardia. The postural hypertension is patient is lying down and suddenly he standing up. So what happens is heart cannot all the blood accumulate in um, in the lower limbs. Suddenly he wakes up, so heart cannot pump adequate blood into brain. So that's what happened in postural hypertension. And reflex tachycardia is when blood vessels are dilated due to alpha 1 blocking. So there's a reflexes that go to heart and increase sympathetic flow in the heart. So that is what it calls reflex tachycardia and postural hypertension. Next is alpha 1 selective blockers. Demonic is DPT and AST. So DPT, these three drugs we use for hypertension. AST we use for benign prostatic hypertrophy. So D means doxazosine, P prazosine, T terasosine, and AST means A alfuzosin, S silodosin, T tamsulosin. So you could identify your alpha blocker, alpha 1 selective blocker by using sozine, doxazosine, prazosine, terasosine, alfuzosin, silodosin, tamsulosin, by that. Next, alpha 2 selective. There's one drug, it is yohimbine.